Well, here's a statistic that is really hard to get our arms around. As many as 6.5 million Americans have iron deficiency anemia or IDA. What are the risks and how can we track our iron levels? Well, here with some guidance is Dr. Neil Gokul, Director of Clinical Education at Southwest Medical. Good morning.
Good morning.
So what are we talking about when we talk about iron deficiency in anemia?
As the name suggests, iron deficiency anemia has to do with low levels or deficiency of iron within our bodies. Our red blood cells are responsible for circulating oxygen to our cells and organs so that we can maintain a healthy and active lifestyle. When we become low or deficient in red blood cells, this leads to anemia.
And how are we diagnosed?
To diagnose iron deficiency anemia, you have to be ordered a specific blood test by your doctor. And it's important to note that those blood tests are not a part of routine or standard general screening. So when you go in for your annual wellness exam or a general physical, this does not include testing for iron levels.
So I'm going to guess here that we might be experiencing a specific set of symptoms. What are some of those symptoms that would alert us that we need this test?
Common symptoms associated with iron deficiency anemia include generalized fatigue or weakness, shortness of breath with activity, pale skin, dry mouth, or dizziness. But it's important to note that many patients can have iron deficiency anemia and not have any symptoms at all, which is why it's important to have a discussion with your doctor to have specific tests ordered if needed.
Should we ask for that just routinely for our yearly exam, or is that something that only comes up if we feel the need?
As you mentioned before, 6.5 million Americans are diagnosed with iron deficiency anemia, many of them not knowing or having symptoms of it before. So it's important to have a discussion with your doctor regarding that. There's a great website that Daiichi Sankyo provides at imayhaveida.com, where you can find detailed information on certain underlying conditions that may put you at risk, certain signs or symptoms, as well as a personalized quiz that can help guide that discussion with your doctor to determine if you should be tested for your iron levels.
Well, is there a certain demographic in our society most susceptible to anemia?
Absolutely. It's important to note that iron deficiency anemia is more common in women than men. In fact, 1 in 5 women of childbearing age will have iron deficiency anemia, but it can affect both men and women. Certain individuals at more of a risk include certain conditions such as heavy uterine bleeding, such as with heavy menstrual cycles, certain gastrointestinal conditions like inflammatory bowel disease, including Crohn's disease, ulcerative colitis, as well as celiac disease, and those individuals with non-dialysis dependent chronic kidney disease.
And what is the usual treatment?
There's a variety of different treatments for iron deficiency anemia, each stemming at the underlying cause of the anemia, as well as in combination with any individual's other health conditions, comorbidities, and medications that may be at play. The website at imayhaveida.com offers a personalized approach to finding out if somebody has iron deficiency anemia and determining the best course of treatment with your doctor.
Dr. Neil Gokul, thank you so much for all this great information.
It was my pleasure.
And we'll be back with more local lifestyles right after this.